Hey guys, in this video I'll be talking about total parental nutrition. Firstly, I would like to stress out some general information about TPN. As you all know, TPN stands for total parental nutrition. Total because it tries to provide all the metabolic requirements that patients need for the growth. Parenteral means this form of nutrients bypasses the enteroute and goes directly into the bloodstream. Talking about the component of TPN, TPN basically has stool water base along with three main micronutrients. Number one is carbohydrate, that is normally given in the form of dextrose or glucose. Second one is protein, which is given in the form of amino acid. Last one is fatty acid, which is normally given in the some form of lipid emulsion. Along with that, TPN also has other components like vitamin, mineral, and electrolyte. As being a nurse, we should always validate the component of parenteral nutrition solution with a prescription by a trusted nurse. Talking about the indication of parenteral nutrition is most commonly used in patients with severely dysfunctional GI tract who are unable to process nutrients. And in some time, in order to provide GI rest in patients who recently underwent GI surgeries, gastrointestinal trauma, severe intolerance to feeding, in such case, parenteral nutrition is used. Along with that, patients with severely nutritionally deficient conditions like AIDS, cancer, burns, malnutrition may also benefit from the parenteral nutrition. Now, something very important to remember regarding your total parenteral nutrition is that your TPNs will always be administered through central line access. Whether it be a PIC line or a central line, this will never be given through a peripheral IV because of its high osmolarity. As you know, fat emulsion contains egg yolk phospholipid, so you need to take a brief history from the patient regarding egg allergy. If patient has an egg allergy, you need to notify to the healthcare provider. When administering TPN, you need to use a IV tubing with a filter size not less than 1.2 micrometer. And in addition to that, the tubing and the bag need to be changed every 24 hourly. As a reminder, we should never administer other fluid or medication or blood products through the TPN line also. When your patient is receiving TPN, you need to closely record their body weight and input and output daily. Electrolyte level and some lab values like liver function test and renal function test should be done every alternative day. And before drawing the blood sample from the center line access, don't forget to stop TPN infusion for 10 minutes. Or you can follow the hospital protocol, as the protocol varies from the hospital to hospital. As the patient with the TPN is at the risk of hyperglycemia from the parenteral nutrition solutions, so blood glucose levels should be strictly monitored every 4 hourly. And another important point that you need to address while using TPN is that you should always use infusion pump. If you need to increase or decrease your patient TPN flow rate, you need to do so gradually in order to prevent from hypo or hyperglycemia. If your patient TPN don't arrive from the pharmacy, in order to buy a time, we can use a 10% dextrose. Thank you for listening this video, and in next video I will be talking about the complication of TPN.